Medication considerations in oncology. Module content. This module includes module outcomes. Aim of the module. Medication consideration in chemotherapy. Chemotherapy administration. Chemotherapy side effects. Medication consideration in targeted therapy. Targeted therapy side effects. Medication consideration in immunotherapy. Types of cancer immunotherapy and their side effects. Medication consideration in stem cell or bone marrow transplant. Stem cell or bone marrow transplant side effects. Medication consideration in hormone therapy. Hormone therapy side effects. References. At the end of the module, patients and their families know the important aspects of different types of cancer treatments currently practiced, how to administer, how they act on cancer cells and the entire body of the patient, and the most common side effects. When side effects require the intervention of the medical team. The module aims to provide, in particular, practical and theoretical information about general aspects related to the types of systemic treatments in oncology and their mechanism of action, starting from conventional treatments such as chemotherapy, hormone therapy, to innovative therapies such as targeted molecular therapies and immunotherapy. General principles related to the indications and benefits of these systemic therapies, in relation to the cancer type by site and stage of disease. Mode of administration, identification of adverse effects and drug interactions specific to each therapeutic class. Medication consideration in chemotherapy. Chemotherapy is treatment that uses drugs called cytotoxics or cytostatics to kill cancer cells or to slow them down. Oncologists calculate the doses of chemotherapy using the person's weight or body surface. The dosage of the medicines can also be adjusted according to age, presence of anemia, significant liver or kidney disease, poor diet, intolerance to full doses, contraindications to current medications, ongoing radiotherapy treatment, chemotherapy administration. Intravenous chemotherapy. Intravenous chemotherapy is administered directly into the venous system, through a catheter, which can be installed on the forearm or hand, or a central venous catheter, which is a larger catheter, inserted into a larger caliber vein, which lasts a longer period of time. Injectable chemotherapy. Many types of chemotherapy are given by injection, depending on the type of cancer. Intrathecal. The drug is administered into the spinal canal through a catheter and enters the fluid surrounding the brain and spinal cord. This type of treatment is used for certain types of cancer that affect the brain. Chemoembolization. Injection of the drug, directly, into the blood vessels that nourish the tumor being treated. Intracavitary. The drug is inserted directly into a natural cavity of the body, bladder, abdomen, chest. Intramuscular. The drug is introduced directly into the muscle mass. Oral chemotherapy. Another way to administer chemotherapy is by mouth, as with other medicines. And in this case, there are cycles of chemotherapy, which allow the recovery of healthy cells, while cancer cells are killed. Being a powerful treatment, special precautions are recommended. Because this is a treatment that can be taken at home, it is very important to keep track of all side effects. Topical chemotherapy. Topical chemotherapy refers to a cream, gel or ointment that contains the drug for chemotherapy and can be put on the skin in the area where the cancer is. This is also considered a powerful treatment and special precautions are recommended. Chemotherapy side effects. Appetite changes. Gastrointestinal problems, nausea and vomiting, diarrhea, constipation. Problems with the mouth, tongue and throat, sores, pain, difficulty swallowing. Peripheral nerve problems, neuropathy, numbness, tingling, leg pain. Fatigue. Infection. Anemia, low red blood cell count. Weight changes. Changing skin and nail color, dry skin. Hair loss. Light bruising and bleeding. Changes in urine, bladder and kidney problems. The brain typical of chemotherapy, chemobrain, lower concentration. Layout changes. Changes in libido. Infertility. Be careful. You need to contact your medical team if the following side effects appear. Fever higher than 38 degrees Celsius. Intense chills. Unexplained bleeding or bruising. Bloody stool or urine. Pain or soreness at the chemo injection site. Unusual pain, intense headaches. Long-lasting vomiting or diarrhea. A rash. Severe allergic reaction, severe itching, trouble swallowing. Trouble breathing. Medication consideration in targeted therapy. Targeted therapy is a systemic type of cancer treatment. This type of therapy targets only cancer cells without affecting normal cells. Targeted drugs also block cancer cells from copying, which means they block the multiplication of cancer cells and the generation of new cancer cells. Targeted therapy side effects. Skin changes, photosensitivity, rash, dry, itchy, red, hand-foot syndrome, altered hair growth. High blood pressure. Bleeding or blood clotting problems. Problems with wound healing. Autoimmune problems. Swelling. Nausea, vomiting, diarrhea, constipation. Mouth sores. Trouble breathing. Cough. Be careful. You need to contact your medical team if the following side effects appear. High blood pressure. Swelling. Trouble breathing. Unexplained bleeding or bruising. Bloody stool or urine. Long-lasting vomiting or diarrhea. Severe allergic reaction, severe itching, trouble swallowing. Medication consideration in immunotherapy. Immunotherapy is the treatment of cancer that uses the patient's immune system to fight the disease. There are two ways immunotherapy works. A. Stimulating the immune system, so that it works better, to destroy cancer cells. B. The use of substances, created in the laboratory, which are similar to the components of the immune system and they're used to restore the functions of the immune system, to subsequently destroy cancer cells. Be careful. You need to contact your medical team if the following side effects appear. Very high fevers. Very low blood pressure. Severe headaches. Confusion or seizures. Long-lasting vomiting or diarrhea. Severe allergic reaction, severe itching, trouble swallowing. Medication consideration in stem cell or bone marrow transplant. Stem cells are young cells, not fully developed, that have the ability, in their mature life, to form different types of blood cells necessary for the proper functioning of the human body. Stem cells grow in the bone marrow. Stem cell transplantation saves damaged from chemotherapy or radiation therapy, and so the patient can produce blood cells, which are vital to the body. Consequently, the use of a stem cell transplant can help the oncologist use higher and better doses of therapy to destroy all the cancer cells. Stem cells used for transplantation come from the patient, autologous, or another person, allogeneic, from the umbilical cord of newborns or from the bloodstream. This type of transplant is used to treat leukemia, lymphomas, multiple myeloma, myelodysplastic syndrome, and sometimes testicular cancer, neuroblastoma, and certain types of cancer in children. Stem cell or bone marrow transplant side effects. Many of the side effects are caused by destruction of the own bone marrow by medicines or radiation just before the transplant. Usually in people taking busulfan or melphalan before transplantation, the side effects are sore throat and throat, nausea, vomiting, infection, bleeding. Liver veno-occlusive disease, the blood vessels inside the liver become blocked, clogged. Interstitial pneumonia. Graft versus host disease, the donor's immune cells see your body as a stranger and fight it. Stem cell or bone marrow transplant side effects. Long-term side effects. Damage to organs due to drugs used in transplantation. Cancer recurrence. Second cancer. People with allogeneic transplants have a higher risk of developing second cancer. Abnormal growth of lymphatic tissues. Infertility, mainly due to chemotherapy or radiation. Hormonal changes in the thyroid or pituitary gland. Cataracts. Be careful. You need to contact your medical team if the following side effects appear. Fever higher than 38 degrees Celsius. Intense chills. Unexplained bleeding or bruising. Bloody stool or urine. Pain or soreness at the chemo injection site. Unusual pain, intense headaches. Long-lasting vomiting or diarrhea. A rash. Severe allergic reaction, severe itching, trouble swallowing. Trouble breathing. Medication consideration in hormone therapy. Some types of cancers depend on hormones in order to grow. Consequently, blocking those hormones can sometimes slow down or stop cancer development. The hormone therapy is usually used to treat certain types of breast cancer, endometrial, adrenal and prostate cancer. Getting hormone therapy can be done by oral medication, injectable therapy or surgery to remove hormone-producing organs, testicles or ovaries. Hormone therapy side effects. For men. Hot flashes, decreased libido, erectile dysfunction, bone demineralization, fatigue, weight gain, memory problems, increased risk of other health problems. For women. Hot flashes, decreased libido, vaginal dryness, bone demineralization, fatigue, nausea, higher risk of other types of cancer, pain in muscles and joints, cardiovascular disease, blood clots and cataracts. Be careful. You need to contact your medical team if the following side effects appear. Fever higher than 38 degrees Celsius. Intense chills. Unexplained bleeding or bruising. Bloody stool or urine. Pain or soreness at the chemo injection site. Unusual pain, intense headaches. Long-lasting vomiting or diarrhea. A rash. Severe allergic reaction, severe itching, trouble swallowing. Trouble breathing.